Unlock the secrets, learn new tactics, and build a winning strategy to win the aging game. Welcome to the Aging Game with Bruce and Susan.
Welcome to the Gambit Part 2. So today's episode of being proactive versus reactive, we really felt that there were two strong topics we wanted to talk about. One was oral health and the other was physical health. So as we go into that, one of the things that was really important to me was I had shared that stat in the beginning about, the number of the population or percentage that's inactive. And the thing that I think is really important is that the lack of activity has a big impact on us, especially seniors. We know that the lack of activity leads to weakened muscles, poor balance, which are both leading factors in falls, which I know all three of us see day to day in our businesses and what we do. So I was excited to bring that into the second half of our double episode here.
So today we have Carly Rhymes joining us. Welcome, Carly. Carly is the local occupational therapist who owns Mobile Rehab. Can't wait to learn about all this, which is a mobile outpatient therapy practice, and Rhymes Integral Therapy for Neurological Holistic Therapy, which specializes in individual, whole body, holistic intervention for client with neurodegenerative diseases. Welcome, Carly.
Thank you very much. It's a privilege to be here. You guys are such pillars in our community and always leading the way for people.
Well, before we get into my question, I ask everybody, we got to go back to these two businesses. So just super quick, can you kind of break both of those down? Because you do so much and I know what you do, but for our listeners, kind of give it to us in layman's terms.
So we kind of have two separate but companies that kind of joined together a little bit. And Mobile Rehab started back in 2020, the COVID age, when getting places was really dangerous and challenging. So we created this mobile outpatient setting where we're treating people as if they were an outpatient client, but we're treating them in their own homes, communities, gyms, and their own pools, and doing those type of things so that they're not going and sitting in a waiting room at a clinic for an hour or waiting for therapy or things like that, where instead we're coming to see them at home. We're seeing how they're actually functioning, how they're actually performing in that area, but we're not doing this kind of home health rehab where the goal is to get you to outpatient. Our goal is to treat you actually in that setting.
Wow. Remarkable.
Thank you. And then Rhymes Integral Therapy kind of grew from that as we started doing research over at Florida Gulf Coast University on neurodegenerative diseases. We've been doing that for about 4 years, and really our Parkinson's and stroke population grew so much in our mobile practice, and it became very evident that we needed to have a center where that was the focus, and that was what we were really working on. So we really developed this facility where we work almost solely with people with advanced neuropathy, Parkinson's, ALS, MS, stroke, and help them rehabilitate holistically rather than just going for this strengthening approach.
Wow, remarkable. So before we dive into our topic today, I ask all of our guests the same question, which is, what is something you know today that you wish you knew earlier in your life or your career as it relates to your specific industry and your clients?
I think specifically for my clients, the thing that I'm seeing become, not just today, but becoming more and more apparent as the healthcare system is changing is 10 years ago, the healthcare system really had this focus on wellness and getting everybody strong and making sure that people were getting better with their idea of better. And in the last few years, we've really seen insurance and Medicare even really take this step back where they're not pushing for people to get back to the level where they consider themselves better like they used to. It's a little bit less of helping people get to that final back to their normal quality of life, if that makes sense. And so people are really having to go out into the community and find these other resources more than ever.
Wow, remarkable.
So Carly, I'm going to kind of back up a little bit because I know some of our listeners aren't familiar with all these different definitions. Mm-hmm. So when we talk about occupational therapy and we talk about physical therapy, can you define those two things?
This is a very controversial question that I think we get extremely extremely often. And that's something that's continued to shift over the last few years. Before, for a long time, insurance defined physical therapy as anything the waist down and occupational therapy the anything the waist up. Then it was kind of a shift where occupational therapy was anything functional and physical therapy was anything strengthening. I think right now the system is kind of looking at it as physical therapy is here for gait and strengthening and muscle repair when it comes to like an individual muscle, where occupational therapy is really out here looking at neurological function, combining the actual function with the loss, looking at maybe you can't open this cabinet, but why can you not open the cabinet? And do we need to adapt it, or can we repair the neurological loss or the body awareness loss in order to help you get back to your previous function?
So when you do your mobile therapy with someone's home, what does that look like?
So, our evaluation is always really watching people in their own environment and seeing how they're functioning and what's challenging and what are they actually doing. Because we have people come and see us in the clinic and they tell us something and we have to just kind of best guess. They're saying they're getting stuck in their recliner or they're afraid to go out on their patio. And we have an idea what a sliding glass door looks like. We live in Florida, but we don't know what their setup looks like. We don't know what it is that's actually stopping them. So we really get to look at how people are functioning at home and adapt what it is that needs to be worked on based on that a little bit more than we can in the clinic setting.
And is that private pay, or does Medicare come involved? Or
Medicare covers up to a point, and it's kind of a balancing act with all therapy right now. As long as they're making progress and Medicare sees it as a gain that is valuable, then we can continue to keep them on Medicare. Right now, this year, we're seeing a little bit more kickback from Medicare where they're saying this is no longer a gain and the patient feels like it's a gain a lot more. And of course, the therapist is like, we know you can get better. So we balance the two approaches.
kind of talking about that, what activities or exercises do you recommend seniors to do to improve their balance and to prevent falls?
So, when it comes to preventing falls, I think it's a whole lot different than the approach has been for many years. We used to hear constantly, stay strong, stay safe. And of course, that's important. We want people to be physically active. Being strong is good for your overall health. But long term, is being strong going to stop you from falling or allow you to continue to shower independently? Probably not. There's things that are more important than strength for you to be able to function long term. And those things really end up being maintaining your flexibility, maintaining your ergonomics, and maintaining your body awareness. For flexibility, we want to make sure that you're not locking muscles. We want to make sure that you're actually able to reach your hands above your head, that you're actually able to move your ankles still, that they're not completely locked up. For ergonomics, we want to make sure that you're maintaining your posture. For every inch that your head is forward, that's 10 pounds of strain on your lower back. So that makes functioning long term very, very challenging. It makes balancing even harder. And for body awareness, I can't tell you how many patients we have. And we watch when you come into our clinic, when you walk in the door and they go to walk in the door and they squeeze all of their muscles in like they weren't going to fit through the doorway. But we knew that they were more than capable of fitting through that doorway. These people aren't huge, but they've just lost that awareness of their body. They can't step without looking at their feet. And those things impact long-term function and fall risk a whole lot more than strength does.
Interesting. I just had a client who fell, and she didn't have, in her mind, she didn't have the strength to get up. And she was on the ground for, she said, over 24 hours. And she couldn't get to the phone. She was just on the ground. So helping people gain their strength is extremely important.
It is, yeah, and helping them recognize why they fell. So a lot of times the fall is not necessarily strength related, but the needing to get up, the strength is required.
I think this one might have been alcohol related.
Yeah.
So
it's Naples.
yeah.
That's unfortunate. Kind of piggybacking on that same question Bruce had, what are things, activities, exercises people can do to improve their mobility or their strength or their flexibility? You mentioned flexibility in there.
We have a lot of people who go to the gym every day that we see in our clinic. We have one guy, he has a six-pack and he still falls 5 times a day. So it's not necessarily just strength, But I think when you look at the research, you can find research that's going to support anything to reduce falls, because remaining active and keeping moving is so important that no matter what, anything is good. But specifically, if you're looking at your flexibility and your posture and your balance long term, I think that Tai Chi has consistently proven to be one of the best exercises out there. Qigong is very similar to Tai Chi, but a little more rhythmic motion. Yoga, aquatic therapy, Pilates, the boxing programs locally do a fantastic job of making sure that people are really weight shifting and aware of their body and staying flexible and keeping moving.
So, and I'm tall, I'm 6'7", and I'm always conscious of my posture. And so can you talk a little bit more about how important posture is and what people can do to strengthen their posture, and to how they can improve their body mechanics so to prevent a fall?
Improving body mechanics is so important, and I think we overcomplicate it a lot. We're always telling ourselves, I have to be able to lift this weight, or I have to have this perfect posture all the time. But if you do low weights and slow motions, you're going to rebuild your basic structure. You're going to rebuild your strength. And if you have to do it initially standing up against a wall and take 1 pound weights and very, very slowly, just slowly raise them up above your head and slowly raise them down in different directions, you're going to have all those spinal muscles kick in. You're going to have your core kick in. You're going to remember what it feels like to be upright, and it's going to help you long term to maintain that ergonomical positioning.
I see all these people, this whole slope where, people have their head in front of their toes and their feet.
Mm-hmm.
And, you just want to, like, okay, straighten up. And, because they're just a fall ready to happen.
It really is. And then they go out and get equipment or a walker or things like that, and they've never went to a professional to get these equipments, so they're not sized properly or not even the appropriate equipment for them, and that ends up making the problem a lot worse.
Wow, that's really I just met someone the other day that was talking about she goes into facilities and will um meet with the residents to resize or tend to their things. And I think it's so important. You hear time and time again, oh, I went to Walgreens and I got a walker. I went here and got this, but it was very informational to learn that you need the right product for you. And we know there's thousands of options for all these equipment pieces. What recommendations do you have for seniors that can either help, excuse me, with age-related conditions, whether that's something like osteoporosis or arthritis?
I think that the biggest thing that we can encourage is to keep moving. And like you mentioned before, we have so many seniors who start to get afraid of getting out of the house and start to get afraid of doing things without a walker. And rather than keeping moving, they end up pulling back. And I think when you first experience that instance where you felt like maybe you had a loss of balance and you didn't fall, but you felt uncomfortable, rather than going out and buying a walker initially, go to your provider and go see a physical therapist for a few weeks, or go get a personal trainer, go to your gym. Most community gyms now, especially in Naples, they have these personal trainers there that you can get for a session or two, and get an exercise program and get moving again, and see if that doesn't solve the issue before it even begins.
I was just thinking as you were talking about falls, one of the things that we've been seeing is that people tend to have a response once there's a fall, but there's also falls that are, prevented, or the person I saw you were going to fall, I helped you, I guided you down. And then I feel in those situations, if it's a spouse, they kind of just say, well, we didn't have a fall, I guided you and everything's okay. Like, there wasn't an injury. I would love to just highlight that even when there's situations like that, that's a sign too we shouldn't be ignoring. People focus when there's that actual fall, but there are those other instances.
And we consider it a fall even if you didn't hit the ground.
Exactly.
Even if you lost your balance enough that somebody needed to save you, or you fell into the counter, or you were stepping over a curb and needed to fall onto a car, that's still a fall. That's a loss of balance. If you were able to recover, then we're happy about that. We're happy there's no injury, but it's still the equivalent medically.
Yeah. And do you look at medications that people are on that could be causing the falls?
We don't review that. That's always on the doctor. That's something that you want to have them look through. And in Naples, we have a lot of different providers. There's a lot of patients that have a provider up north and a provider here. And sometimes those medications do go missed, that they don't know that this doctor prescribed that up north and this doctor has it changed something down here. And especially those first few months that everybody's seasonal comes back down, we see a lot of medications playing into people's performance.
I bet.
Wow, yeah. I mean, we know seasonal patients, there's always challenges with them across the states.
I know with my mom, she was 93 and a fall risk, and she started doing physical therapy, and it really gave her a purpose, and it gave her a place to go and to get exercise. And there was a huge improvement once she started, getting some strength back, and so important.
And I think the hardest part of my job and what breaks my heart the most often is we get these people in and they become like family, and we start working with them and we see them make this great progress. And then it kind of gets to the point that it's like, okay, you've done great and you really are ready to go back out to the community. And because they didn't have these exercise programs, or they weren't using the resources at their community gym before, when we go to discharge them, they're terrified because they think they're going to go home and just go back to sitting, rather than us. And we can encourage, go join a yoga class, go to your community gym. They have these fitness activities and these things, but they still have this fear that if I am not coming here, I'm not going to do well. And if we have that already in place, that they were doing Parkinson's boxing or they were doing the yoga's class, and that relationship is already there, I think they feel a lot better about getting back into the community.
And it's so great that you can go to someone's home.
Yeah.
It kind of takes all the excuses out of the way. It's just, I'm coming to you.
Yeah, it does, especially with traffic these days. Yeah.
Absolutely. So what is a common mistake or misconception that you see in your industry with seniors?
I think one of the biggest mistakes that we see in our community and across the board with seniors is somebody who's going out and teaching balance. And there's always going to be not so great providers and amazing providers and teachers and things like that. But I think the thing that's missed the most is these people come in to teach these fitness classes, and they've had a lot of training on like dexterity and the sports injuries and these sports impacts. So they come in and they're like, because I know dexterity, I know balance. And they try to translate it over to the senior population. And it's simply not true. It doesn't translate across lines. Teaching somebody who is athletic, a football player, how to be more agile on the field is a whole lot different than teaching somebody who's losing awareness and has the tendency to retropulse and do these type of things to maintain balance.
Wow.
Good stuff.
Yeah.
If our listeners wanted to learn more about what you do and this entire topic, how can they reach you?
We have a website that has a lot of the research articles that we've done up at FGCU, and just a few other resources in there, and that's going to be www.rhymesintegraltherapy.com. But they can always reach out, and we always try to be helpful to the community. We have people call quite often during season that are looking for these exercise programs and these things. And if somebody's brought them to us and we know it, we're always happy to share that information.
Is there a phone number?
There is, and I should know it off the top of my mind, but
Okay.
they all run together, and I don't want to give you the wrong one.
We'll get back to that.
We'll add
post it
on our website. We add all of our guests and all the contact info, so we will add that. And trust me, I get it. I have so many numbers and can't keep them straight. It's not like the old days where you used to dial the number.
I know. I gave somebody our fax number the other day. They're like, I've been calling for 3 weeks. I was like, so sorry.
It happens to the best of us. Trust me, when you're juggling so many things, I get it. I think this is, it's such great information. I think that the work that you do in our community is amazing. I think that, with Dr. Linden, we were talking about how, he's a partner to you on your dental journey. And we strive to see that with all of the providers that we know that are working with patients. And I think that that's, clearly in you as well, that you're on these journeys with them. We've shared many clients together, how they speak of you always warms my heart and brings tears to my eyes, because I wish there were more people, that really cared about our seniors and wanted to make a difference. I think the research you do, all of that. So I would encourage all of our listeners, you can go to our website and find the link. You can go to her website directly, but learning about what Carly's doing and her team in the community is remarkable, really making a difference.
Thank you. I appreciate you guys. And you've both, both consistently stood above the rest when we see a lot of different providers come in and it's clear that they've lost contact of the fact that we're dealing with people. You guys have always stayed very, very involved.
Thank you.
Yeah, they're definitely people to us.
Mm-hmm.
Bright Star Care of Naples and Fort Myers, providing exceptional in-home care. At Bright Star Care of Naples and Fort Myers, we believe that you and your loved ones deserve nothing but the best. Our team of highly trained nurses and caregivers are committed to delivering the highest standard of in-home care. We offer a wide range of both medical and non-medical services to cater to your specific needs. From companion care and personal care to skilled nursing and therapy services, our professional care team is here to meet your needs, both now and in the future. Bright Star Care is proud to provide the highest quality of care and prioritize in-home safety. We are accredited by the Joint Commission, and all care is overseen by a registered nurse. With Bright Star Care, you can have peace of mind knowing that your loved one is in the best hands. To learn more about Bright Star Care of Naples and Fort Myers, visit us online at brightstarcare.com or give us a call at 239-992-4779. We are available 24/7 to answer any questions you may have. Bright Star Care of Naples and Fort Myers, where exceptional care meets compassion. Locally owned and operated since 2006.
Well, welcome to Checkmate. As we wrap up today's episode, I think we had two wonderful guests with a ton of great information. What do you think your, must moves are for everybody as takeaways?
So such great information, a lot to absorb. And, I think with the Dr. Linden, I think having, good oral care, having a partner in your dental journey, I think is really important. I think doing the preventative measures to help you stay healthy, help your oral health be well. I think, I really took that away. So I think that was important with Dr. Linden.
Yeah, he was fascinating. I mean, he's definitely gained himself a new patient with me, but just wealth of knowledge, such a nice person. And that partnership just really stuck out to me. I think that was, for me, heartwarming. I don't think you see that a lot with providers.
And I got to say, I always had this fear of going to the dentist. I don't have it anymore. And so it's pretty cool.
It's funny. I had asked him as one of our pop-up questions, why do you think people fear the dentist? And, I fear the dentist. And I really loved his answers. It seemed like he was really in tune to the patient and what their fears are, not just his, perception and how he helps overcome those. So I think that was really welcoming.
And with Carly, I started thinking about everything, and I think we always say this, it's a common saying that, move it or lose it.
Mm-hmm.
And I really took that, that's what I took away from this, is that, you got to stay healthy. You got to stay active. You got to, put one foot in front of the other and exercise, and doesn't have to be hardcore. You can just start very light, but you got to do something.
Yeah, activity is so important. One interesting thing, I know with time, and we didn't really get into it too much with her, but her practice is a mobile outpatient practice. So her coming to the home, that's under Medicare outpatient therapy. So if you're going to an outpatient physical therapy place, 3 times a week, and that's a challenge for you, XYZ, this is a great option where they come to your home and you're getting I love what she was talking about, like the sliding glass door. And I think I hear it in my industry a lot, I'm struggling with this, I'm struggling with that. But when you see the environment they're in, it's so different. Remarkable what they're doing.
And I know, both of us do this in our professions, is that we visit people in their own homes and get to know them in their own homes. And how important is that to understand their lifestyle and how they live and how their home is laid out? Very important.
Yeah. If you're going to meet someone where they're at in their journey, seeing their home setting and what they're living with and what they're working with is really important. I love that. And when she created that was wonderful. Too bad we can't bring the dentist to the home setting.
I know some do visit senior communities. So great takeaways from our speakers, and very exciting. So Susan, what's going on in the community this week?
Well, we've got a couple things coming up that I want to share. One is I had the pleasure of meeting Kara Loffer. She's the director of community relations at the Naples Botanical Gardens, and they have a variety of programs. They have one coming up here throughout the summer. It's called Summer Cooler in the Garden at Naples Botanical Gardens. But I would encourage you, even if you think maybe the garden isn't your thing, I would tell you to check it out. They have so many fun programs for all ages. They have a lot of great programs with seniors. So I say check it out. It's also beautiful. And on a Saturday morning, go enjoy a walk. Also coming up on Monday, the 26th, the Senior Blue Book. So we had Amanda Barton on a couple episodes back. And they are hosting a Senior Blue Book University event that they call. It's Medicare versus Medicaid. So it's all about ways to use your plan, understand what you have, and understand the differences. So that is in Bonita Springs on the 26th. It's at 12:45. And if you want to learn more about that or any of the other events they have, you can go to seniorsbluebook.com.
And not only August 26th, that's my wife's birthday, so it's a very special day.
Happy birthday.
And so I would say, so important to learn about Medicare and Medicaid. So much confusion out there. And so I would encourage our listeners to attend as many things as you can to learn about the differences between Medicare and Medicaid and what it covers and what it doesn't cover. Just so much confusion. And the more you learn, knowledge is power.
Mm-hmm.
So I would encourage everybody to do that. And happy birthday to my wife.
Happy birthday to your wife. Absolutely. Well, this was wonderful. I'm really excited for next week. So next week we're doing, I think it's a little bit of a sensitive topic, but so downsizing with heart. We know that downsizing, whether you're downsizing in your home or you're moving or any of that, can be challenging. And I'm really excited. We're going to have Marla on with us, a local professional organizer. I know I'm not doing her justice in my description of her right now, but you know her.
I can tell you after listening to the Marla, you're going to go back and you want to organize your drawers and start clearing out stuff. And so she's very motivational and very insightful about how to downsize and what do you do with all your stuff.
Yeah, we know everything has a story with our seniors, and that can be a challenge. So I'm really excited to have her on and to share that. And I really look forward to that next week.
Thanks. Great seeing you.
You too.
Be sure to subscribe to our podcast and follow us on social media. You can also find more information and resources at www.theaginggamepodcast.com.